Hello there. My name is Dr. Reed Neubaum. I'm a chiropractor and with physical therapy privileges at Ultimate Health right here in Bel Air. I've been a chiropractor for about 10 years now and have treated neuropathy patients for the past 8. I put this presentation together for anyone suffering with neuropathy. Especially with neuropathy, I believe that knowledge is power, and the more you know and understand about neuropathy, your chances of overcoming it are that much higher. So, if anything, first I want to give you clarity, and then we'll go over some options on how to fight back. Because if you do have neuropathy, then you'll know that this is no way to live. So, let's get into it. So, most people who reach out to us are here for one of a few reasons. They've already been diagnosed with neuropathy, or they know the symptoms that they're having and they've looked it up and maybe they do have it. So you might be feeling numbness, tingling, burning in the feet or the hands, and pain. It's painful. And it's really not just about those symptoms, it's also what those symptoms mean for, your functioning every day. And one of the biggest things is feeling unsteady when you're on your feet. It's hard to walk when you can't feel the ground or if your feet are that painful. So, that last one is really the big part, independence. So, most of the people who come to see me are really, that's their main concern. So, the real concern, it's more than just the symptoms. It's about the confidence, your confidence on your feet. It's about whether you feel steady, walking to the mailbox, walking to your car. And let's say you are driving, it's about whether you feel safe finding and pressing the brake pedal. And then it's about avoiding activities that, because you don't feel safe on your feet, then you avoid. And and here's the honest part, and I'm not saying this to scare anyone, but neuropathy, the normal progression is that it worsens over time. It's a tough thing to get over. It's hard. But and again, I'm not saying that to scare you, but it's more to explain that, why treating it as early as possible is very, very important. And to talk about what to do, first you got to understand what's happening inside the body. So let's go over that. So defined peripheral neuropathy is a condition affecting the small nerves, and it usually starts in the feet, although it can happen in the fingers and hands. And when they're not functioning properly, that's when you feel the numbness or burning. It almost feels like a pinched nerve, but really it's a little bit different. And we'll get into that in a second here. But point is, your feet are numb, they're tingling, burning, and then your balance becomes less reliable. You don't get good information from your feet on where the ground is and how to balance yourself. So that's why you get balance issues and trouble walking when you have neuropathy. And that's also why your activity decreases, which certainly doesn't help. So that's what's going on as far as the balance goes and the definition. And I have to emphasize this again. It is serious and it does get worse over time. Um, Explain that a little bit more in a sec here. Let me load up the next slide. Neuropathy can develop from a lot of different causes. By far, diabetes is the most common. So with diabetes, long-term blood sugar elevation, it starts to damage the small blood vessels, particularly the ones that feed nerves. And that's where the nerves come into play there. So really it's first a circulation issue and then a nerve issue. Aging alone reduces circulation. That can affect it. Disc issues, trauma can also certainly contribute. In the case of disc issues, it's affecting the nerves further up the chain in the back. Chemotherapy, Alcohol, it can affect a lot of things, including nerve health. So different causes, but all of these have a couple of things in common. So underneath all these, circulation, decreased cell energy. Think of it like the metabolism of the nerves shuts down so that they can't fire properly. And then also it's inflammatory. So all of these three things, circulation, cell energy, and inflammation, all cause neuropathy. So anything that affects those things can cause neuropathy. So that's what they have in common. So a little bit deeper into what's going on. It progresses for the same reason it starts in the first place, circulation. Blood flow decreases over time, or a condition affects the blood flow, and then it perpetuates because you're not as active. So the decreasing activity certainly doesn't help. The circulation drops even further, so it gets worse. Less nerve stimulation leads to more decline of these nerves. So you're really starting to see a circle here where circulation comes down, the nerves aren't happy, then circulation goes even further down. So it's a tough cycle to get out of. And this is also why medications aren't usually a long-term solution. So while medications are great, they may reduce the pain perception. They don't actually restore sensation. So it can help with the pain and the burning, but they do not improve balance. They do not improve the nerve functioning because they don't affect the circulation. So they do change how your brain interprets the discomfort. So it blocks the signal of that pain, and so you feel the pain less, but the nerves aren't changing. They are still in decline. That's why normally you have to take more and more dose of those medications for it to keep working. So, and this is actually one of the biggest myths around it, that, meds are a solution. Again, if it solves your pain, I'm happy for you. But it's just not usually a long-term solution. So actually, this is a good segue into going over more myths. Other common myths you may have heard, I hear them all the time, that the nerves are dead. They are dysfunctional, but no, they are not dead. I hear it all the time too. Nothing can be done. Maybe besides meds, that's what a lot of doctors tell people with neuropathy, but it's not accurate, and they may not know about the things that we offer here. Stimulation can absolutely help. We see it all the time. And then lastly, insurance covers what keeps me the healthiest. Not always. While insurance is there while you're in a crisis, maybe for medications, but they're certainly not proactive, or they don't cover regenerative therapies. So it doesn't mean improvement isn't possible. It's just that they don't cover certain things. So we'll get into it later, but part of our program is not covered by insurance, and some of it is. So just bear with me. I'll get into that further here in a minute. At Ultimate Health, so first we have to figure out what's going on. We start with a thorough history and an examination, and then we build a plan around that. And most of the time, it's a combination of laser therapy, chiropractic care, physical therapy, decompression if there's a spinal thing going on, and balance training. Each of these play a very large role. And remember all of the causes of neuropathy. It would make sense to address the root causes, right? So again, circulation, the biggest thing, energy for the nerves to use, and inflammation. So laser therapy helps all three of those. It improves circulation, it gives the cells more energy so that they can function, and it resolves inflammation faster. Chiropractic and physical therapy help restore joint motion. It helps the nervous system. kind of wake it back up by giving the joints and the muscles, nervous system input. So we're firing those nerves to wake them back up. And then exercise, of course, well known to increase circulation, but also challenging your balance in a safe way will train you to, be steadier on your feet. It's one of those use it or lose it. So doing that methodically and systematically is also very important. Last part is nutrition. Nutritional strategies can absolutely support nerve health as well. Got to get your vitamins in. Got to get good diet that's not going to inflame you and keep the problem going. A little bit more about laser therapy, because really it's the primary driver of how we treat neuropathy. So while chiropractic and physical therapy, they improve movement, they improve strength and balance. Laser therapy is the one that works directly at the nerve and the circulation level. It improves blood flow to the teeny tiny blood vessels that go to the nerves. It stimulates what's called ATP production, and ATP is just an energy source. Think of it like gasoline. It's a fuel that all of your cells use to heal and to function. So it another way to think of it is it boosts your metabolism wherever we use the laser boosts in metabolism. So, and that also helps reduce inflammatory stress. So it gets inflammation out of the way for the nerves so it can start signaling properly. So in other words, laser therapy helps create the biological environment that allows the nerves to function better. And without improving circulation and giving those cells more energy, progress is limited. It's why the laser is so important. Such an important piece of this program. Best part, it's considered non-invasive. There's a picture of it right here of just, we have this lens that shines some light, and it's painless. It heats up just a little bit, and that's it's pretty simple of a treatment to be on the receiving end of. We get you comfy and you lay down, and we slide the laser over the skin, and it wakes everything back up. Do want to touch on a little bit of research on this. So clinical studies. Now this particular study was in diabetics and chemotherapy related neuropathy. And what they found was reduced neuropathy pain, improved nerve function scores. So they have a form all their patients fill out, and it measures all these things. It's like a questionnaire. And they found that nearly 90% of patients experienced large improvements in their scores even at the start. So beginning within weeks of starting laser therapy. And that was laser therapy alone. If someone chooses to include laser therapy, consistency is very important. So it's a system, right? There's a protocol for this, and that is 3 times a week for 4 weeks, and then you drop down to 2 times a week for the next 2 weeks. 16 treatments over 6 weeks, and frequency matters because we're trying to stimulate, meaningful change in a short window, and these treatments build on one another. So you really have to hit no less than 2 weeks. There is a little bit of wiggle room just for schedules. We're all humans here. Sometimes it's hard to get somewhere 3 times a week, especially for that long. But again, they build on one another. Frequency and consistency matters highly. So you might be a good candidate if you're motivated to stay active. Sometimes people, it's just not bad enough. My hope is that, it doesn't progress, and that if you're having a milder case, then it stays that way. But remember, it often does, progress. So if that's you, if you're motivated or if this is holding you back, I would love to help you. Again, scheduling can be an issue. That's why I go over the protocol. It's 3 times a week, 4 weeks, down to 2 times a week for 2 weeks. So I think 6 weeks, we're going to be seeing a lot of each other if we're doing that. And then lastly, kind of tied into that insurance piece, laser is not a covered service. So it got to be prepared to invest a little money in it. So let's just kind of recap all this. So 6 weeks of neuropathy treatment. Again, what's included? You want to hit 16 of these laser treatments in that 6-week protocol, with or without chiropractic and decompression, and then the PT part. That's balance training and some dedicated, strengthening, some physical therapy. When we have to monitor your progress along the way, because if you're not improving, then we got to make sure that we have things right and that we're not missing anything. So we're going to be checking your progress along the way. Most people just want to so all right, get to the chase, Reed. What's it cost in and out the door, they say. So the investment, it's $130 per treatment. 16 treatments totals over a little over $2,000. Chiropractic and physical therapy are billed to insurance, if we're in network. And when you see a chiropractor for if you have Medicare, the copay is typically $25. So again, that's 6 weeks. That's the total. Now, some people need less, some people need a little bit more. Really, the true protocol, some people get away with 12, some people need a little more. So anywhere between 12 and 20 is usually good enough to get you all the way there. But 16 is about average. So as far as an expectation, 16 is kind of usually the magic number of how many times you need to get treated. And laser therapy is the main driver. It produces the strongest outcomes, and if you're following the protocol consistently. But progress can still be made without it. Sometimes people, it's you can get better without it. Just the balance training, just the PT, get spinal decompression, and improvements can be made. So if you want to consult with me, we'll review everything and make a plan together. It has to make sense with your schedule, and your budget. But yeah, we can work with you. Many patients report improvements very early on. I'm talking within the first 4 to 6 treatments. And honestly, that's our expectation. You should notice a difference after somewhere in between 4 and 6 treatments. I'm talking reduced burning, reduced tingling. If you're numb, you'll start feeling things. I just had a patient this week, noticed he could feel the crumbs on the ground of his kitchen floor. Had not felt the ground like that in months, maybe even years. And that was within the 3rd treatment. He's coming back to me saying, I can feel crumbs on the kitchen ground. It's fantastic and works very fast. And honestly, if you're not seeing improvement by 4 to 6 treatments, then we might hit timeout. We might go back to the drawing board and kind of revisit the plan. Again, we're expecting improvements in that time period, because I'm not going to let you go through this whole program without improvements. So just a little bit of managing expectations there. If this resonates with you, next step, I got to check you out. So if you come on in, I'll go through my exam, get your history, and we'll talk about this. We'll make a plan and see if this is right for you. There's no pressure. I just want you to be clear on everything so that you can make the right decision for yourself. And I'm here to help you. You can. I'm going to put in below this video, if you just scroll down, there's going to be a form, and you can request an appointment by filling out that form. If you'd rather, our number is right here on the screen. You can call us at that number, or you can text us. Our office, just so you know, we're right down just south of downtown Bel Air on Emerton Road, so 924. Very easy office to get to, not hidden at all. And if you have any questions, feel free to call or text, leave me a message, or my personal email is right here on the screen. All right. Looking forward to meeting you and helping you.